Tobacco use and cigarette smoking remain to be major risk factors for certain respiratory and cardiovascular diseases. Now, recent data from the World Health Organization show that around 8 million people die each year because of tobacco use. For this year's observance of World No Tobacco Day, governments are urged to grow food instead of tobacco and give tobacco farmers a means to switch to more sustainable food crops. Joining us now to tell us more about the dangers of tobacco smoking, we have with us Dr. Jessica Catalan-Legarda. She specializes in pulmonology and is the advocacy program chair of the Lung Center of the Philippines. Good morning and welcome to New Day, Doc Jessica.
Good morning, Doc Freddy. Good morning to all the televiewers.
Now, first of all, I'd like to talk about the situation here in the Philippines. Gaano karami pa tayong mga Pilipinong gumagamit or naninigarilyo ng tobacco products? Marami pa ba ito? Because over the recent years, we've seen a trend that it's actually going down. Is this true?
Yes, Doc Freddy. Actually, globally, there are about 1.3 billion smokers. In the Philippines, based po on the latest survey, about 15.9% of the population smoke tobacco in any form. Actually, that's approximately 16 million Filipino smokers. So napakarami pa rin po, Doc Freddy.
Okay, so that is significant. Dito sa Pilipinas, napakarami pa rin naninigarilyo. Now, what are the more common illnesses or yung mga sakit that people can get from smoking cigarettes?
Well, the most common diseases first would be respiratory diseases. So that would be chronic obstructive pulmonary disease or what we call emphysema. And of course, the risk of getting lung cancer. So actually, aside from lung cancer, you can get any other forms of cancer. And aside from that, you can have the risk of developing cardiovascular diseases, stroke, and also peripheral vascular disease.
Okay, so all of these are definitely significant illnesses that you get from tobacco use. Pero pag-usapan natin a little bit, Doc Jessica, yung mga hindi naninigarilyo but they are around itong mga gumagamit ng mga tobacco products or yung mga second-hand smokers. Let's talk about some of the risks. Ano yung mga risks nito and how comparable is that doon sa risk ng actually naninigarilyo?
Okay. So for active smokers kasi, Doc Freddy, they are risk of the nicotine dependence since this is the addicting substance. And then, of course, yung diniscuss ko po kanina, they are increased risk of developing chronic respiratory diseases. But for secondhand smokers, since they are constantly exposed po to cigarette smoke, they are increased risk po of getting respiratory infections. And of course, kung may pre-existing diseases po sila such as asthma o kaya some form of allergies, constantly kapag na-expose po sila, pwede pong mag-exacerbate or mag-atake. So, etong mga second-hand smokers po na to, usually increase po sila of developing repeated respiratory infections.
Okay, so ang ibig sabihin nun is kahit hindi ka naninigarilyo, if you are around or if your partner smokes, you are still at risk of getting these diseases associated with smoking. Now, Doc Jessica, let's zero in on lung cancer. What are some of the most common signs and symptoms of lung cancer? Gusto malaman ng ating mga viewers yung mga ganon. And how do we know na kailangan na natin magpatingin sa doktor?
Well, if you are a smoker, tapos may mga nararamdaman kang symptoms such as chronic cough, and then may difficulty of breathing, you have back pain, occasional back pain, and of course, unexplained weight loss. And usually, the age of onset po, Doc Freddy, would be at the age of 40 years old. Kasi usually, ito po yung may significant smoking history na po. Then, that's an alarm, no? That you should consult na po your doctors para po magkaroon ng early lung cancer detection or at least screening for this kind of patients.
Okay, now for this year's theme, it is grow food and not tobacco. What are some of the activities of the Lung Center of the Philippines for World No Tobacco Day, Doc Jessica?
Yes po, today, May 31, join us as we celebrate the World No Tobacco Day. So the global theme po of the celebration is we need food, not tobacco. And this actually gives a strong message to our policymakers to support the farming of food rather than planting tobacco. So you can check out our Lung Center of the Philippines Facebook page to watch our program today. So we have prepared po a lot of lay fora topics to increase awareness on the ill effects po of smoking and how to manage it. So together with the smoking cessation program and the Quit Line 1558, we will have a month-long celebration of this No Tobacco Month. So yun naman po. So join us as we celebrate this special occasion.
Okay, so thank you once again, Dr. Jessica Catalan-Legarda, for joining us this morning here on New Day.